land and make what seems hopeless hopeful. Rubus Pure Summer is back with weekly cash prizes and the grandest prize offering of all time. A piece of land in Cayman Brac valued at $80,000.
Win a piece of land?
You heard right. Dream big and head home this summer with Rubus. Receive 8 stamps on your entry card to be entered to win a piece of land. That's Pure Summer. Rubus. Fuel the difference.
Wattler and Hislop are the workhorses of the worksite. Earth-moving, heavy equipment services or rentals. Here to ensure your foundation will always be the strongest. 24-hour septic services, deep well drilling, auger cast piling, concrete pumping. We get our hands dirty. Doing great work for great people. Can you dig it? Contact Wattler and Hislop today at equipmentservices.ky or call 949-4880.
We will rock you.
For over 25 years, Island Heritage has weathered more than 25 hurricanes throughout the Caribbean. We've been there for our customers, settling thousands of storm-related claims, delivering best-in-class customer service, and paying out over $1 billion to support our customers. We are Hurricane Strong. We are Island Heritage. Visit islandheritageinsurance.com today.
Innovation Small Business Fridays are back. Join us on June 17th, 24th, and July 1st with everything you need to pivot to success, transform your business, and elevate your growth. Hear from exciting keynote speakers like Frank Schilling, Mark Farrell, Kadeen Maris, as well as participate in interactive workshops. Learn how to make money, gain digital know-how, and pitch your exciting new business idea. Do not miss this opportunity. We'll be giving away USD $15,000 in cash and prizes. Register now at flowbusiness.co/events.
Connect to the culture.
Turn it up a little bit. Yeah.
Star 927.
Welcome to the big show. Today it's a full house because we have the best in the business. And of course, you're asking yourself, which business? Your business. I want to keep your body healthy and operating in the way it should. Sometimes even I might bring in guests that recommend invasive surgery to remove anything that's unwanted or to give medications to alter your body chemistry because we want you to stay in the state of tip-top shape. And today we're discussing a game changer. I want you to tell me, what could be more steady than a surgeon's hand? I've seen a surgeon remove the skin from a grape and put it back. What could be better? A robot's hand. Who is here in studio? Dr. David Stone, the obstetrician and gynecologist at OceanMed. Dr. Pooja Monteiro, the consultant gynecologist at Healthcity. Dr. Binoy, the clinical director, chief cardiothoracic and vascular surgeon at Healthcity. And of course, the chief of business at Healthcity, Shomari Scott. Welcome, everybody. Welcome.
Thank you for having us,
Shomari.
Matt. You get better. You get better with the introduction every time. You see,
we're going up.
Now it sounds like a movie that you were preparing us for, that trailer, right?
One day I'll fail.
You have that trailer voice, right?
Yeah. One day it's going to be bad.
It was the year 2000.
In a world.
See.
But I'm just prepping you that it can't. At some point I'll go downhill. So I want you to remember the good times. Yeah.
But you have another decade, man. You're like LeBron. You have another decade.
Shomari, I see a trend at Healthcity.
Yes, sir.
You're always pushing the envelope, always wanting to go one step further. And you've crossed the line, Shomari. You've gone into robotics. You're now hiring robots. You're past HR. What does HR say?
But we promise you this. Remember, we keep our promises, Matt. That we said at the tail end of this year. We had a lot of new exciting things that we're doing to fill the gaps in the Cayman Islands. And as we always mention, we always have the patient at the center. And what can help us to deliver the best outcomes is what Healthcity Cayman Islands looks to bring to the Cayman Islands. And the Vinci X machine that we're speaking about from a robotics perspective is another first for the Cayman Islands and one of a handful in the Caribbean. And previously, we would have been the first in the Caribbean to do the artificial heart, LVAD. We were the first in the Caribbean to have the Pantrell of what's that again? pentology of Cantrell, which is the heart outside the chest of the young person and putting it back in, and many other firsts. And this is the first in the Cayman Islands having the robotic machine. And just to mention that not only is it a first with the robotic machine, it's the first having a great partnership at the highest level with OceanMed. So OceanMed is known as the marquee facility when it comes to women health and it comes to surgeries, with Dr. Stone, who has many years of experience and 25 years of experience. And when we look at ethos aligning and having a partnership to deliver excellence, we're just very grateful that Dr. Stone and the OceanMed team aligned with Healthcity to be able to provide this type of cutting edge surgery for the first time here in the Cayman Islands.
I can just imagine that you always have to stay ahead of the competition, and like you said, you're the first in the Caribbean, so congratulations. They will have to keep up. But across the board, robots seem to be they seem to have a competitive advantage. They don't get tired. They don't take smoke breaks. They don't complain. Just input the data and they get it done over and over. And I guess the big question is are they going to replace the good doctor one day down the road?
And Matt, it's robotic assisted surgery. So at the end of the day, it's still a higher level of machinery, but if you just have the machines, then what is it? Just machines that are sitting there. You still need a high level of skill from physicians to be able to come together as a team to get it done. And we also have our very own Dr. Pooja, who's also here from Healthcity with many years of experience that would have been part of the team for when we talk about the first surgery that actually already occurred in the Cayman Islands and the quality of outcomes. So it takes great physicians, a great team in order to make it happen. And as I said, we're just very proud to have Dr. Stone as part of the team in this instance to be able to do do these types of surgeries. And the great thing about Dr. Stone is previously in the US, he was one of the first surgeons to actually have their hand with robotic surgery, and he was a part of that society, after many years left to come to the Cayman Islands, and I'm sure shed a tear or two when he had to leave the robots behind, but now very excited to once again be able to operate with the robots here in the Cayman Islands.
I want to know, when we say surgery, it's such a broad word. What are we talking about? What type of surgery did you do that made history in Cayman with the robot?
So what we actually did was use laparoscopic technology, but we used it in a way that in many ways opens up your hands and your vision as if you were doing an open case.
And can you just break down the word laparoscopic?
Certainly. It's a way in which you do what we also call keyhole surgery, where we're actually placing small incisions or making small incisions onto the belly of the patient, and we're inserting special instruments that can be used to help dissect tissue, resect tissue, and otherwise manipulate tissue as if we were making a bigger incision and using our hands.
Okay, so automatically benefits. Less scarring, smaller incisions, maybe less blood loss.
That's correct. If you think of it, the smaller the incision, the less likely you're to hit blood vessels or cause bleeding. The smaller incision can heal up faster, so there's less chance of infection. And the patient healing faster means that she's often able to recover faster. She's able to get back to doing the things that she wants to do, he or she, because laparoscopic surgery can be done on men as well.
Okay. And just from my understanding, when you say laparoscopic, like if you're dealing with the heart, sometimes they go through the groin is that considered?
So most of laparoscopic, the word lapar really refers to the abdominal area. So most of the approach is going to be through the abdomen, through the areas that include points of the bowel and the bladder and of course the reproductive organs going into the pelvic cavity.
Which is your specialty down at OceanMed.
Wheelhouse.
So I want to know who called who. Did Shomari pick up the phone and call OceanMed, or did Dr. Stone? Who started this partnership and why? It had to be the salesman.
Mr.
Business.
You see everything in time, and it just so happens that I also know Dr. Stone in a different aspect, in that he's the gentleman that delivered my last rambunctious boy and did an absolutely fabulous job of doing so. But Healthcity has been in discussions with OceanMed on and off over time, just understanding all of the great quality of offerings they bring to this marketplace, and understanding where we were going in the future in regards to neonatal care, which we're talking about. Remember, radiotherapy, everything oncology will be able, within 95%, to take care of at the end of this year, when we have that first phase of the hospital, the first 10,000 square feet done. But next year, we'll have the rest of the 70,000 square feet done, and we'll have neonatal care, and the $1 million babies that we speak about. We'll be able to keep here and obviously do it at a fraction of the cost. So in preparation, looking at what we were going to be doing in the future, it only made sense to speak to OceanMed and a physician, the quality of Dr. Stone. So it was ongoing over many months and many years. And, you know, when we mentioned about the new things we were bringing, Dr. Stone's eyes lit up when he heard about I guess you look like what a new father would look like seeing his baby when Dr. Stone actually heard about the fact that we were doing robotics, and then, you know, filled us in even further in regards to his resume, which obviously we knew all of the great work that he's been doing in the Cayman Islands, but to hear that he had that experience previously as well, it was a marriage that just came together hand in glove. And that's all she wrote, as they said, and here we are.
Something has to wake you up in the morning. There has to be some drive. Why do I want to go to work today? And as a doctor, I'm sure you can always go deeper into your field. But as a man, when a man gets a new toy, or when a man gets a new piece of equipment, you can spend hours looking at the owner's manual. You can go and do hours of research into something that you yourself are interested in. So tell me about this machine. Is it you alone at the controls? Is it a VR machine that you're stepping into? Describe it for the audience. What are you looking at?
Certainly. You know, what you're looking at are really three components to this system, to this platform. And the first part is the surgeon's console. So all three of these components are in the operating room. We are within feet of the patient at the time that I'm operating the console, the surgeon's console. It's there that I have my hands on special devices that actually allow the robotic arms that are now placed through those trocar incision sleeves.
Don't forget the stakes, people. The stakes are that he's controlling joysticks that are inside somebody's abdomen. Just bear that in mind as he goes. I just wanted to show them the level where the critical control that you have.
That's correct. And the way you can think of it is that the robot will not move unless not only do I have my hands in position, but my head has to go into a special area on the console to begin visualizing the field. So there is a delay in any movement if I pull my head back, or if I stop touching the instruments, the hand instruments that allow me to do certain maneuvers and gesticulations with my hand, and wristing with my hand that is mimicked by what is the robotic arms that are in the patient. So at all times, I am in full control of not only the robotic arms that are performing the procedure, but also my vision. And that's a big piece. And I think Dr. Pooja can talk a little bit about that.
So you said that you were not operating this machine alone. It's a team that's beside you. So on the surgery that was historic for Cayman, Dr. Pooja, can you just remind us the type of surgery that you did, and then tell me about your role operating or assisting Dr. Stone?
So our very first case in the Cayman Islands on the robot was a myomectomy, which is a fibroid removal surgery. Mind you, this wasn't a very simple case. If I have to tell you how big the womb was, it was roughly the size of a 4 or a 5, I think a 5 to 6 month pregnancy. That's how big it was. So
are you saying that the womb or the fibroids caused the womb to be that big?
Yes, exactly.
Okay.
So externally is when we would examine the patient, is what we would say that it's around a 5 or 6 month pregnancy, which means you would be feeling it up to the level of your belly button, if not a little above it. And then when we went in, there was this 10 centimeter huge, pretty looking fibroid sitting at one end, and there was a 6 centimeter fibroid sitting at the other end. And Dr. Stone made it look like a piece of cake. And
well, how do you
smoothly.
get the fibroids out if the incision hole is pretty small?
So we do make another incision that we extend somewhat so that we can begin to morcellate or break down that piece.
Chop it up.
That's correct.
And take it out piece by piece. But visually, I mean, just I've seen dramatizations of surgery courtesy of Hollywood, ER, Grey's Anatomy. They do a decent job, but that's the visual that we all have to go on. So how can you see inside somebody's womb if the skin, if you're not opening it up to the light? How can you actually, are you using radar, or using, what type of data is driving your decisions?
Certainly. So we do have these access points, these small points, and each one of them, I might add, are smaller than the diameter of your finger. Through these small slits or tubes, if you will, trocar sleeves, we're actually placing in instruments, including something called a laparoscope, the actual scope itself. It's like a telescopic lens. This particular lens has depth perception. It has 3D and HD technology, and it can magnify the area that I'm visualizing by 10 times. It also allows me to see in various angles that make it difficult sometimes to do the surgery. So I can look down at 30 degrees or up at 30 degrees. I can actually use my instruments at the console to actually dictate what area that I'm looking at. So instead of relying on another colleague to hold the laparoscopic camera, I'm actually able to do it myself. So that level of autonomy allows me to anticipate my next move. It's intuitive that I know how I'm going to be looking at tissue. And so it gives me that greater command of the surgical field.
I just want to just go a little broad picture for a second.
Sure.
Unfortunately, the patient had fibroids. Successfully. Was the operation successful?
Yes, absolutely.
I just want Shomari, what are we doing? The successful surgery, congratulations. But the underlying cause of the fibroids, the reason that they grew in the first place, is that something now that will she have to possibly go under surgery again, just from a gynecological standpoint? What is the cause of these fibroids, and is this a permanent solution, or we have to continue operation?
So like most things in medicine, there's no cause. It can just happen to any woman. But we've seen that it affects women who are obese, racially, African American women, Caribbean women tend to have huge fibroids. So I come from India. Fibroids are very common. So you would see, it's like having pimples or boils over your face. So that's how common fibroids are on a uterus. Do we need to take out every fibroid? No. Do we treat every fibroid medically? No. It's just the ones which cause trouble, whether they're 2 centimeters or whether they're 20 centimeters, is when we deal with them. But what I've noticed since coming here is that I've barely seen fibroids which are under 3 and 4 centimeters, and very frequently seen fibroids which are 10 centimeters and above, which definitely would be symptomatic and would need to be taken out. So there's no real reason. And your other question, whether she would need another surgery, we don't know. She might. What I've noticed is if someone has had a fibroid removal surgery, their chances of developing fibroids again, pretty high. She might come back for another fibroid surgery as quickly as 3 years down the line, or maybe she might not need another one.
And I can also add, though, is that when you're doing a robotic surgery or other laparoscopic technologies, you do a lot of preoperative workups so that you're looking at where all these fibroids are. So you're trying to pinpoint them and remove the ones that need to be removed. And in this case, we were able to remove pretty much all the fibroids that we could identify. And that sometimes is not capable with other approaches.
Yeah, I can just imagine if you have somebody open on the table, the time is of the issue. How long do I, can I operate for? But I guess if your incision point is smaller, then maybe you can keep her on the operating table for a little bit longer.
Not only that, so like Dr. Stone was saying, if a woman has 10 fibroids and I go in for surgery, my aim is not to remove all of those 10 fibroids. Maybe she has fibroids which are like 2 centimeters, 1 centimeters. I'm not going to go looking for all of those. The principle of any fibroid or myomectomy surgery is to remove maximum number of fibroids with minimum number of incisions on the uterus, so that the insult to the uterus is lessened, because many of these women will then want to have babies, want to have pregnancies. So if we take those many cuts on the uterus, we are increasing the chances for them to have adverse pregnancy outcomes like, a uterine rupture, loss of pregnancy, and we don't want all of that. Is why we try and take out as many fibroids through the minimum number of incisions that we would need to.
I want to take this time to big up all of the ladies that went through C-sections, because it's probably painful to recover from a wound.
Not probably. It is painful.
It is painful. Forget what I said. But just tell me the layers of tissue that you have to go through to get to the uterus or the womb. Just what are you cutting through?
So you're going through skin, then you have your subcute layer of fat, then you have another layer of fascia. Imagine it like a tissue paper, but a little thicker. Then you have the toughest layer that's known as the rectus sheath, which is separating your insides from your outside, the most important layer. Then you have the rectus muscle, the abs as we call it. And then you have the covering layer of all your organs on the inside, that's the peritoneum. And then you reach the womb. So there are 7 layers before you reach the womb, and each has to be cut individually when a woman is having a C-section, and closed individually as well.
And this is something that you do how often? How often do you take a scalpel and do surgery like what you just mentioned?
So at Healthcity, we do not have obstetric services right now. So we're not doing the C-sections, but yeah, if we have to, like Dr.
Sorry,
Stone
Shomari.
said.
I'm so I can say that Shomari is beaming me with his eyes, his Superman eyes. Not yet. We want to say thank
Not
you.
yet.
We want to say thank you to the HSA for all of their work in the maternity ward, and also doctor. Yeah, there's so many people, and of course, if you're pregnant, is that something that you encourage women to come to your office to get a consultation and go through the process?
Yes, certainly. I'm not just a gynecologist, and certainly laparoscopic surgery is involving gynecology. I am an obstetrician, and I do catch babies.
You do, yeah. But robotics are not yet involved.
No, we're safe.
That's going to be the day.
That's not going to happen anytime soon.
Okay. So far, I've heard all about the benefits upon benefits. You know what happens sometimes on my computer? It freezes, and I have to shut it down and reboot it. And who's running this technology? This machine, the Da Vinci machine. What operating system is this on? Is this safe? Are there any instances when the machine could go down?
So the system is designed by Intuitive Surgical, and the company's was founded in 1995. In that time, there have been, including up to now, 4 generations of this Da Vinci robotic system.
Mm-hmm.
They have an extensive process of checking and rechecking and triple checking and number of checks to make sure that the robot system that you're getting is safe. The track record is pretty impressive. To date, there have been well over 10 million laparoscopic robotic-assisted technologies or procedures done in the world. Of those, over 3 million of them have been related to GYN-related surgeries. You have well over 35,000 U.S. trained physicians who are using robotic technology, and there's well over 25,000 globally outside of the United States. I have used this robotic surgery hundreds of times, and I have yet to see a misfire or fail from the robot. Has there been a situation where it may have shut down? Yes, there was a power outage, and that was concerning, but we were able to make the adjustments. The instruments stopped where they were, which is good, and we were able to complete the task once the power was back on.
And the plan B is that you are there. You're still in the room.
That's correct.
Yeah.
If we have to convert, we can convert, whether it be to convert to a laparoscopic approach away from the robotic. If many times, if we are gotten through the most difficult, challenging part of the procedure, which the robot aided us in, we may complete the task with the traditional laparoscopic approach. Do we also know that if some cases, if we're not able to, we may convert to an open case. But the interesting thing is, and studies have shown this, the conversion rate from a robotic case to an open case is much lower than a traditional laparoscopic approach to an open case.
So in this case, it was fibroids. What else is the machine capable of assisting you with?
So not only can it do myomectomies, which is the removal of the fibroids, it can actually, in cases when it's appropriate, remove the uterus itself. It can be done, used to help with patients who may have pelvic organ prolapse. There's a whole condition called endometriosis, which really affects a lot of women, more than we tend to appreciate. And sometimes resection of the endometriosis can be therapeutic. With the robotic system, you have more precision in your dissection and resection, and you can use it for that as well.
I can just imagine that although they are doctors now using the machine, as the technology continues, maybe it'll get a little less expensive. Maybe it'll have use cases in other areas, maybe for the elderly, maybe for laziness. Maybe if I want to sit on my couch and have, you know what I have right now? I have a robot vacuum, which still has a lot of work to do, boy, I tell you. But it's coming. It's coming. It's already in my house. And actually, I called the company the other day because a part of it failed. I said, listen, this thing should be under warranty. But there's a lot of bugs to be worked out. But it's probably because of heavy investment in the medical field that a lot of the technology spills over into other areas. Shomari, interesting fact, the cordless drill. You're a tool man? You have a toolbox?
Yes, I have a toolbox. How well I use it, that's up in the air.
Well, I'm sure when a door needs fixing, you know either how to get the toolbox or how to get the phone.
Yeah, how to tighten screws.
But the cordless drill was an invention from NASA. So that spilled over into construction. But basically, if you're out on the spaceship, you can't get the cord out there to get the power.
But also to mention, when Dr. Stone was talking about power outage, luckily at Healthcity, we have huge generators in the back. So if CUC ever goes down, we definitely have contingencies that Dr. Stone won't have to worry about the robot going down because we have continuous power at Healthcity.
I like
even with let's knock on wood, the H word that usually comes through. Based on our hospital and our generators, we'd be able to be up and running at full capacity between 7 to 10 days. And if obviously you would, only use the most important areas in the hospital to extend it further if power on the island was down for longer than that. But, we haven't seen that in a while and hope not to see it again in this lifetime. But we're prepared.
And you are.
We didn't need it last year for a bit, Shomari. I remember I stayed at the hospital when Grace happened.
Yeah.
That was I don't want to even know how Ivan was, but Grace, we didn't feel anything when we were inside the hospital. It was cozy as a cocoon. I only knew the disaster when I reached home.
So let's talk about the most important factor when somebody is considering their health care: bills. You step into the doctor's office. You're in front of Dr. Stone down there at OceanMed. He says, "Listen, this is your issue, and this is my recommendation." And you said, "Doctor, sounds great." And then the next thing is, well, let's discuss payment. So, Shomari, in general, healthcare is already expensive. Now you're telling me I have to pay for the robot and I have to pay for the doctor. So now I have to pay two. There's another employee in the room.
Right. So there's not another employee. It's one of the tools by which we use to make sure that you have the best outcomes possible. So the great news is that for the Cayman Islands, in the most part, well, not in the most part, we have one of the best insurance penetrations in the Caribbean. And for the types of procedures that will be occurring, insurance covers it. So for the most part, the patient wouldn't actually see any additional costs to their bill. So that's a good part. This is an investment Healthcity is making in order to make sure that with OceanMed, we're delivering the best outcomes possible.
Well, what's your slogan? It's not your slogan, but it is in a nutshell what you offer: better healthcare at let's say more affordable prices or more competitive prices. What's your terminology? How would you phrase it?
Well, I mean, we offer high quality care that's affordable, right? When you look at our quality of outcomes, and we're always mentioning, Matt, that anybody can go on our website and actually see our quality of outcomes and how it compares to some of the best hospitals in the US. And you know that our quality of outcomes are very high. And at the end of the day, we have it at affordable prices, which is why you have persons from the Caribbean, the US, Canada, traveling to us now that borders are open, traveling to us, one, for the high quality of care, obviously, but two, based on our pricing that's also very affordable.
When we come back, we're going to talk more with Dr. Pooja, more with Dr. David Stone, and also we're going to bring in Dr. Binoy, the clinical director down there at Healthcity. Stay tuned, Cayman. More Medical Mondays with your premium content station. This is Star 92.7.
Yeah, connect to the culture.
Yeah.
Turn up your decibels.
Pie decimator joint.
Star 927.
Meanwhile, at the Burger King's castle, my people cry for spice. What progress with the spicy alchemy?
Sire, hot news. The new spicy chicken sandwich is finally ready.
Oh, exquisite fire. I must tell the people. Friends, Caymanians, Whopper fans, I bequeath to you the new spicy chicken sandwich.
The king is bringing spicy back. The new spicy chicken sandwich is made with juicy, crispy 100% white meat and features an all-new spicy glaze. Try one today and feel the heat. Only at Burger King.
CUC advises customers that their customer service center on North Sound Road will be moving to Caribbean Plaza on West Bay Road. As of Tuesday, June 7th, the customer service center on North Sound Road will be closed to walk-in customers. For more information, contact CUC's customer service team at 949-5200 or email at service@cuc.ky.
No matter where you are or where you're going, you deserve to be in control of your freedom. Introducing the new Cayman National online banking and mobile app experience. Enjoy quick and safe access with facial recognition and fingerprint login. Transfer funds and pay bills with ease. Sign up for online banking today and download our new mobile app, available in the App Store and Google Play Store.
Friday, July 1st, Cool Beats comes alive for the Happy Parrot Block Party. Performing live, Nessa Preppy. Hola, Tunde. Second Star. Good music by one of Cayman's very own. Scorch Bud is one of Miami's hottest DJs. LL Cool Blade. Doors open at 8 p.m. Tickets available now at eventco.ky.
Star 927.
Yeah. Connect to the culture.
And we are back in full effect with 3 doctors in the house. Shomari, how many microphones do you think I have? We have the full house today, but fear not. Whoever, and I just want to encourage anybody who wants to contribute, grab the microphone and share the message with the Cayman Islands. If you are sitting in your car and thinking, you know, who could benefit from a consultation with Dr. Stone down there at OceanMed, or who could benefit from going in to see Dr. Pooja down there at Healthcity, I want to encourage you to do it. Cayman, we are so on the fence with our ideas of how to keep healthy. Sometimes we think tea is enough, bush tea, fever grass tea is enough. But over the past few months, I'm leaning more towards going to see the doctor. As a male, especially Caribbean men, we're opposed to going in. So we have a new machine in Cayman. It is a robotic machine. Recently, there was history being made as it went in and took out fibroids. Dr. Stone was behind the controls. Dr. Pooja was assisting. And the question is what else can the machine do? Now that we've spent the money and Healthcity has the machine, Dr. Stone is on island. Doc, you just like a McLaren, just like a Lamborghini, sometimes we need to take it on the road and see what it can do. So what's the other use case for the machine?
So the robotic system is designed, or was originally designed, to fill a market that was underserved, and that was the area of minimally invasive surgery for the treatment of prostate cancer, and in particularly removing the prostate. That's the organ that is in men that has a relatively high degree of developing cancer in. The preferred route today is robotic removal of the prostate. About 15, 20 years ago, it was an open case, and laparoscopic capabilities were limited to trying to remove it in the traditional laparoscopic sense. When the robotic system came on board, it really, within a matter of a few years, captured the market to where today, I believe it's more than 95% of all prostatectomies, that's the removal of the prostate, are removed with robotic technology. So in addition to that, you can look at other areas. So there's, besides gynecology, which I'm in, and the urology, which would be involving the removal of the prostate and prostatectomy, you would also look at other fields such as general surgery, where you're involved with removing, say, the colon, the large bowel, or you're needing to remove a tumor off the rectum, or you're doing some other organ removal or resection or alteration. The area of bariatric surgery has come into play with robotic-assisted technologies. And we also can see that in thoracic surgery, a lot of the areas in the areas of the thorax where the lungs are hard to get into, and even including the heart area, hard to get into. But with robotic assisted technology, you can get small incisions, get these small, tiny robotic arms into those areas and do resections or dissections that would previously be very difficult, and in fact would need to have the patient opened up.
And before the break, we were talking to Shomari about costs, and I was saying, thinking in general that more equipment, more tools would mean more costs. But I can see how this could bring costs down. If you have a machine that can take the place of 3 surgeons that you might need to do an operation on the lungs, it could be very complicated. But you're able to get in and out with a robot. And just to go back to the prostate, there's so many young men out there in radio land that are probably thinking, I know I have a prostate. What is the purpose of my prostate? Let's start there. so because they say, oh, you know what, after 40 we want to check on the prostate to make sure it's not enlarged, to make sure it's not squeezing your urinary tract. But I was going to ask the question, are we going to reduce it if we get in there with a robot? Are we going to try to reduce it? Are we going to remove it? And then the question came to me, what is the purpose of the prostate?
Matt, first of all, don't bring us into that area where we are not the expertise. Okay, so I do not want to give the suggestions that is not at the right. So I'm not answering that question. Dr. Stone, do you want?
I'll tell you what it is. So the prostate is the gland in men which provides a part of the seminal fluid, or a part of the semen comes from the prostate. So that is the main function of the prostate gland. It's located at the base of the penis. By the virtue of its location, when it enlarges is when it causes problems in urination, frequency, sometimes inability to pee, which then leads you to a urologist, who then examines you and finds that your prostate is enlarged. Either it's a benign enlargement, which is extremely common, or it is a cancerous enlargement, which is also fairly common. And the prostate being a deep structure, so it all comes embryologically from the same units. So the uterus, the cervix, the prostate, they all differentiate from the same set of embryological units. So they're all located in the same location. Hence, the robot being so good for these structures, because sometimes when you have an overweight patient, an obese patient, and you have to go into the pelvis for deep pelvic surgeries like endometriosis, like Dr. Stone was saying. So endometriosis is a condition where the lining of the uterus is literally growing outside of the uterus. It could be growing on the ovaries, it could be growing on your bladder, on the muscle layer of the uterus, in the pelvic basin, on the rectum, on your intestine. We've seen it all. So it tends to be extremely painful, excruciatingly painful, and sometimes surgical resection can provide symptomatic benefits. So in such cases, when you have deep endometriosis, which is deep down in the pelvis, even with my longest instruments laparoscopically, I may not be able to reach the target pathology. I may not be able to get it all out. This is where the robot is really extremely useful when it comes to laparoscopy, because I have that much. The robot can do things that my hands wouldn't be able to do, or the laparoscopic instruments wouldn't be able to do. So say, for instance, my laparoscopic instruments are super thin, and at the end, I have my working instrument is probably around 1 centimeter or 2. The rest is just the length which it's giving me. So what it would do is not allow me that much of a rotation. So I would have a forward, backward, and a sideways axis, or I would be just able to turn my instrument and do the same forward, backward, and upward, downward, sideways movement. Now with the robot, the dexterity has improved so much. It will do what your hands want it to do. So it will move in a 360-degree manner, which means I can move in whichever plane, whichever axis I like, and the field of vision is mine. I eliminate the need for an assistant. So it's like Dr. Stone was telling me at the beginning of the case, that he heard it from one of his superiors, that doing a laparoscopic surgery with an untrained assistant is like two people trying to tie a shoelace, which makes so much sense. Because your cameraman literally is the one who's directing the show. If he or she is not showing you what you need to see, it's going to be an extremely painful and difficult surgery for you. You'd rather do an open surgery than waste your time and cause more insult around the tissue. So what the robot does is it eliminates that. It gives the surgeon the control for the camera. So the surgeon is directing the camera where he wants, places it there, and then uses his instruments, then moves the camera, and so on and so forth. The assistant is there to help out if the instruments need to be changed, if say the camera lenses are dirty. Again, another big change with a traditional laparoscope versus a robot assisted laparoscope is the eye. So it is a camera, it has eyes. So the traditional laparoscope has one eye, so it goes in, I can move it in whichever direction I'd like, but it's still one eye. Versus a 3D laparoscope or a robot assisted laparoscope, which has two eyes, very much like ours, gives us binocular vision, gives us depth perception, gives us 3D vision. There's magnification like binoculars would do. So it gives me so much more information than a laparoscope would do. So that's mainly the advantages of the robot over a traditional laparoscope.
I just want to understand how you got trained on the machine. The machine just came. Dr. Stone was using the machine in the States. So how did Pooja get her hands to test drive the machine and to work alongside Dr. Stone?
So it's not just the men, it's the women who like to drive their vehicles as well.
Okay.
So when we got the machine, we all sat in that console and we all had our go at it. Yes.
Yeah, and a good analogy for in discussing medicine on the radio is kind of hard sometimes. So we use analogies, but taking care of your car, taking care of your body, but also in this example, when there's a two-person team, I'm sure a lot of the listeners have seen rally driving on TV. The driver is in excess of 100 miles an hour on a dirt road, and then the person beside him is saying left turn, 30 degrees, handbrake now, clutch now, and there's so much dust kicking up on the road, and you can only see a couple of feet, 100 feet of you ahead, but you just have to believe and trust that your right hand understands the terrain, understands the road, and last night spent the whole day, the whole night, up all night planning and saying, okay, this is the speed that we're going at. I know it's like there's a lot of communication that's happening between you two. So you don't want to get in a fight or an argument before you guys go into surgery. Has that ever happened? Is there beef between doctors sometimes that causes rifts in the operating room?
Not at all. I think the real joy of working in this collaboration is that I'm working with people who are passionate about what they do. You can be well trained, you can have come from a good background of education, you can have a great fund of knowledge, and of course those are all important to become a proficient surgeon. But there's something about having the passion for wanting to execute at the best level you can. And Dr. Pooja, I see that in her, and I think she sees that in me. We get along very well. I'm humbled because I have someone in that room who has the fund of knowledge and understanding of the anatomy as well as I do, and you can rely on sometimes that expertise to help reaffirm maybe a decision you're going to make. The wonderful thing about laparoscopic surgery, even greater than open cases, is that you can have that whole operating room see what you're doing. That means there's more eyeballs looking at what you're doing. There's more people checking at what you're doing. And I think that makes for a safer environment. You know, it's kind of like what happens in the aviation area. You have more checks, more balances. And when you're doing laparoscopic surgery, there are these vision carts that we use. They're monitors that we have in the room. And so other people, the anesthesiologist, your other team members within the operating room, they're all able to see what you're seeing. And of course, Dr. Pooja is doing that as well. And so I feel very honored and humbled in many ways to be able to work in such an environment where there's that passion, there's desire, and that drive, all for the same purpose, is to get that patient off the table safely and effectively.
And just to be inquisitive, I think of it as again, sorry that Hollywood is my only reference, but they have these huge theaters, these huge surgery theaters, and there's so many people in the room. So I assume there's nurses, but who else is there? Who do you want in the room to cross check you and to ensure and say good job, doctor?
So we have in the room the surgeon, obviously. You have an assistant who is at the bedside, and Dr. Pooja, that's where she is at, and helping at times through an assistant port when necessary to hand instruments into the operative field as they need. There is also assistants specifically designed or assigned to the robot itself. If I need to change out a robotic instrument, I have an assistant that will be able to do that. I have an anesthesiologist that's there. And of course, taking care of the patient's airway and checking the vitals and such. And then you have a circulator, somebody who's going around and providing access to instruments that need to be pulled off from a cart or some other area, or getting medicine. So there's sort of our gopher, if you will, in the operating time in real time. So we've got a team, and we've got a good team at Healthcity.
You always need more. You always need a runner. Somebody.
It never changes.
You guys have any anything that you do before every surgery? You have music playing? You have any go-tos? You have
We
any?
definitely have music playing during surgery.
Yes.
For sure. We made Dr. Stone listen to Indian Bollywood music the last time.
Oh,
Wonderful music.
Yeah.
Wonderful music.
as long as it's not gangster rap, everybody should be somewhat calm. So I'm just trying to imagine what's going into the patient, and if 640-4040, or just email info@healthcity.ky. Remember, Dr. Stone is at OceanMed if you are interested in getting his expert opinion. Dr. Pooja is at Healthcity. And I just want to say thank you all. And next week, we'll be back with more Medical Mondays on your station, Star 92.7.